While recent research from the World Health Organization shows that air pollution is responsible for 1 in 8 deaths globally, the Department of Environmental Affairs is considering an application from Eskom, South Africa's biggest air polluter, to not comply with the country's already weak air quality standards. If granted, the country's energy supplier will emit even higher levels of pollution, severely impacting people's health.
To paraphrase, Eskom has made it clear that the cost for Eskom to comply with the legislation is simply too much compared to the benefits that could be gained from compliance. So that tells you quite a lot about the lack of respect for human health, because what it in fact means is that keeping the economy going is more important than looking after the health and well-being of South African citizens.
While most of the country benefits from Eskom-produced electricity, a new study by the campaigning group groundWork shows that it's the health and lives of people in the Highveld that are the ones most impacted by Eskom's pollution.
I used to live next to a mine. Every now and then I kept buying medication, thinking my child had flu and stuff like that. When I went to the doctor discovered that my little boy had strong symptoms of asthma. He will have to take medication for the rest of his life. I was spending a whole lot of money on medication, and I was wondering that how many other people out there are like me.
South Africa's Highveld area has among the world's highest pollution levels. Due to health concerns, a part of it was declared a priority area by government in 2007. This area, home to 12 of Eskom's coal-fired power stations and hundreds of mines, experiences a disproportionate amount of pollution from South Africa's energy supplier. groundWork's new study shows that Eskom's electricity generation is responsible for 51% of deaths due to respiratory illness and 54% of deaths due to cardiovascular diseases related to outdoor pollution in the area. Recently released health reports commissioned by Eskom in 2006 indicate its power stations at the time were cumulatively responsible for 17 deaths and 661 respiratory hospital admissions per year.
People tend to make the association between air pollution and respiratory effects much more easily than any other sort of outcome. This is because it's almost instant. You know, if you have a high level of pollution today, children are going to be complaining tomorrow or a few days later. But other outcomes that we are also concerned about, cardiovascular problems, so problems related to the heart, and also longer term effects such as cancers. We're also now becoming more concerned about reproductive effects, the effects that this may have on the on pregnant women, the unborn fetus.
groundWork study also showed that residents in the Highveld priority area are 3 times more likely to die of respiratory or cardiovascular diseases due to Eskom's pollution than residents of Tshwane. And they're 6 times more at risk from mercury pollution than residents in Cape Town.
And in addition to that, Highveld residents have the highest instance of burning coal in their homes. So they've got a double burden of indoor air pollution plus outdoor air pollution. And apart from moving away, they can't escape from Eskom's impact on their health.
The study shows that Eskom's pollution is the primary driver of poor outdoor air quality in the Highveld priority area, having a much greater impact on people's health compared to outdoor pollution from domestic burning of coal.
The statistics that we calculated show that for every child that is experiencing health problems due to outdoor air pollution that is linked to burning coal or wood inside, 3 of them could be attributed to Eskom's coal-fired generation.
The Department of Environmental Affairs is responsible for ensuring the environment is not harmful to people's health.
We have the ambient air quality standards, which actually define what safe air is in South Africa. We also have standards for industries, big industries, who emit large amounts of pollution. We call them the minimum emission standards.
These standards, which Eskom is applying to be exempt from, were jointly agreed between industry, government and civil society over a 5-year negotiation period.
Yes, Eskom has applied for exemption because we can only do so much in the time that's available to us when we are able to shut down power stations. Eskom feels that far bigger impact can be achieved by having projects to look at how can we reduce the burning of coal and wood in households itself.
There's this debate about whether our main concern should be indoor air pollution versus outdoor air pollution. If you are in the vicinity of a source of outdoor air pollution, then you should be concerned about the outdoor air pollution. And if you also are exposed to indoor air pollution, you should be concerned about both.
I think there's no doubt that we need to address the indoor air pollution. But the problem is, let's say we have modern energy services in everyone's homes, then we need to focus on outdoor pollution. And if we don't deal with outdoor pollution now, then what we're going to find is that we've now electrified everyone and people are still getting sick and dying.
The Centre for Environmental Rights has filed a legal objection to Eskom's application. It argues that the cost of compliance is cancelled out by the cost to people and the state for medical treatment of air pollution-related illness.
Even though the health impacts of air pollution are well known, and the Air Quality Act was passed to try and mitigate that and strengthen air pollution control, it's clear that the interests of the polluting industries override the public health concerns.
It's a common reality that the young suffer and the aged suffer. But let's remember, the young of today are the adults of tomorrow. We can say that the entire population is vulnerable because sick children become sick adults.
So, in simple terms, the air that we breathe is not safe for human health. Are we really living in a society which prioritizes human needs, or are we living in a society where we prioritize industries who are just around our communities to make profits and nobody worries about the social well-being of the people around that kind of an area?
What I can say to Eskom and our government, we are human beings. Will you please help us?
Campaigners want the government to reject Eskom's application to not meet minimum emission standards and to provide support for residents of the area already suffering from the parastatal's pollution. If the Department of Environmental Affairs grants Eskom's request, those living in the Highveld priority area will continue to pay with their health and lives as Eskom continues to pollute.